Welcome to the podcast Bringing Virtual Care Home, a part of the Slice of Healthcare Podcast Network. I'm your host, Tina Null, and I serve as the Chief Clinical Officer for Anelto. For those of you not familiar with Anelto, we're a leading technology platform that brings innovative healthcare solutions to seniors and other at-risk populations, allowing them to stay connected to their healthcare team from anywhere, but most importantly, their homes. My guest today is Dr. Desh Mohan, who's the co-founder and chief medical officer at Koda Health. Today, our topic of conversation is how advanced care planning can help people age gracefully at home. Welcome to Bringing Virtual Care Home, Dr. Mohan, and thank you for spending time with me today.
Yeah, absolutely. Thanks so much for having me, Tina.
Sure. Before we dive into our topic, can you share with the audience a little about your background and how you landed in the position that you're in?
Yeah, absolutely. Absolutely. So, Tina, as you mentioned, I'm currently the chief medical officer at Koda Health. But the story of how I got there starts a few years back. So, I'm an internal medicine physician by training. So I grew up in Texas for most of my life. I went to medical school at UT Southwestern Medical School in Dallas and did residency at the Baylor College of Medicine in Houston, Texas. And I practiced as a hospitalist for a few years, all across the country, actually. And one of the things that I had seen as a hospitalist during my practice is that a lot of the patients that I had taken care of really never had the opportunity to express what kind of care was important to them before they came into the hospital. So a lot of these patients were honestly really confused about what they wanted, about what care they really valued, and never had the opportunity to express that to their care teams or loved ones. And it was a really confusing time for patients and for their family members and loved ones. And I just saw the trajectory of care that these patients went through, and it was a really difficult moment. On the contrast, there were those patients that really had these conversations and had defined what was important to them. And you can see that the kind of trajectory of care that they received was just completely different. And so it was around that time that I was recruited into this fellowship at the Texas Medical Center called the Biodesign Fellowship. That's where I met my co-founders. And we had the opportunity to work in a lot of the big health systems in the Houston area. And we identified that this was a problem that most hospital systems were having. A lot of their patients just really never had the opportunity to define what kind of care was important to them. And from there, we spun out Koda Health, which is really focused on helping health systems and health plans help their patients, help their members better define what kind of care is important to them as they are aging and facing serious illness.
Wow, that is so important that we're not using an acute episode for decision making about care for the entire lifespan. So great work. Can you explain to the audience how advanced care planning helps people age gracefully at home?
Yeah, absolutely. Absolutely. So advanced care planning itself is a process where patients can proactively, so before they get seriously ill, while they're still healthy, they can define what's important to them when it comes to their future medical care. So it's a process that helps them explore their values and beliefs. It helps them express who they want to make decisions for them if they're not able to make decisions on their own. It helps them learn about the risks and benefits of different life support treatments like CPR, ventilators, or dialysis. And in essence, it helps them define what kind of quality of life really matters to them, and what they're willing to, what kind of quality of life they're willing to accept, and what aspects they're not wanting as they're aging. So it's a process that they're able to go through with their loved ones and family members, as well as their care team, so their doctors, their nurses, their social workers. And in the end, if they go through this process, it can help generate documents like their living will and medical power of attorney forms. But these are legal documents that can help help them protect what kind of wishes are important to them. But the most important aspect is the conversation itself, is being able to go through and define this and share with their loved ones so that if and when a crisis occurs, those loved ones, their family members, know what kind of care really matters to them.
Wow. That's wonderful. So you answered a part of my next question, but if you could expand a little bit on how the advanced care planning affects the family of the individuals who participate in it.
Yeah, absolutely. So as I mentioned, as a clinician myself, I've seen many times that when patients come into the hospital, oftentimes they're not able to make decisions on their own. They're incapacitated or sick to the point where they're not able to make these decisions. And so oftentimes it's those loved ones or those family members that are having to make these decisions. And there have been a lot of studies that show that these are significant moments of stress and anxiety for these loved ones. And there are some studies that also show that without any sort of guidance from a previous conversation or from some high quality advanced care planning or any sort of advanced directives, those loved ones oftentimes pick the wrong decisions around 50% of the time. And that's a significant amount where those patients are not getting the kind of care they want. And so oftentimes these decisions fall to those loved ones and to those family members. And so one of the things that I think is really important is what we do at Koda. So at Koda, we help facilitate digital advanced care planning. So we know that oftentimes these conversations are really difficult to have. Physicians, nurses, social workers, we're all human too, and it's difficult to talk about these serious end of life care type discussions. And what we realize is that patients are often more accepting and willing to explore these concepts in a digital manner. So the Coda platform, which we developed, essentially guides patients through this journey where they're able to learn about this process through simple videos and prompts. They're able to define what kind of care is important to them. They're able to share their wishes with their loved ones and their family members. In the end, they're able to generate their care plans, so legal documents like their advanced directives, which they can share with their loved ones and family members. That's really the most important aspect of this whole advanced care planning is that those loved ones know what kind of care is important to those patients at the end of the day, so that they can advocate for their loved ones. They can advocate for that patient. And that's what we really focus on is making sure that patients can define what's important to them and those loved ones are aware of those care preferences.
Yeah, I can't imagine how much better a child of an adult child of a patient would feel knowing exactly what their parent or loved one wants and confident in their expressing that decision for that patient. So,
Yeah.
well, thank you for that
Yeah.
work. So before we close, do you have anything else that you would like to share with the audience about Koda Health or advanced care planning that you haven't talked about already?
Well, I think one thing that's important is we're coming, to the holiday season. Thanksgiving's coming up, Christmas is coming up, and this is oftentimes that we're getting together with family members and loved ones. These are also oftentimes really the best opportunities to start these discussions. Whether it's with Koda or without Koda, we really want to make sure that people are talking to their loved ones and sharing what's important to them. So as you see your family members and you see your loved ones, start this conversation. It can be difficult to start, but you and your family members will just be so much happier and so much more appreciative after discussing it with everyone. So I definitely encourage everyone to start the conversation.
Yeah, great suggestion to capitalize on the moment and the season. And I'm going to have a perfect segue with my family when I say I hosted a podcast
There you
on advanced care planning. Let's
There
talk.
you go. There you go.
I don't know how popular I'll be, but we can have the conversation. So, Dr. Mohan, thank you again for being my guest on Bringing Virtual Care Home. We share a common mission of helping people age gracefully at home. Me and my company through remote patient monitoring, and you and yours through advanced care planning. So I'm looking forward to continue to be a partner with you. And learn about what else advanced care planning or Koda Health is doing in that space. I want to thank all of you for tuning in to our Bringing Virtual Care Home podcast, and I hope you'll stay connected to us on LinkedIn and join us for our next episode soon.
Wonderful. Thanks so much for having me, Tina.